बार जोरदार तालियों की लहर हो जाए आप सबकी तरफ से। निरोगी राजस्थान मेरी फेस्ट 2022 में आप सभी का बहुत बहुत स्वागत अभिनंदन। राजस्थान में उच्च स्तरीय चिकित्सा सेवाओं का नया अध्याय आज से आप सभी के बीच में शुरू होने जा रहा है। इन पलों का हम सभी को बेसब्री से इंतजार था। आईपीडी टावर अनटाइटल्ड संस्थान भूमिपूजन व सेवा 2 दिवसीय मेडिफेस्ट प्रदर्शनी के शुभारंभ का कार्यक्रम आज आप सभी के बीच में सुबह प्रारंभ किया गया। शिलान्यास किया गया राजस्थान के माननीय मुख्यमंत्री महोदय श्रीमान अशोक गहलोत जी के कर कमलों के द्वारा। कार्यक्रम की अध्यक्षता की नगरीय विकास स्वायत्त शासन एवं आवासन विभाग मंत्री राजस्थान सरकार श्री शांति कुमार धारीवाल जी ने और कार्यक्रम के विशिष्ट अतिथि रहे श्री प्रसादी लाल मीणा जी चिकित्सा एवं स्वास्थ्य मंत्री। साथ ही हमारे बीच में देश के जाने माने चिकित्सा क्षेत्र की हस्तियां इस मंच पर मौजूद थी, जिनकी उपस्थिति में इस कार्यक्रम को आप सभी के बीच में सुचारू रूप से चलाया गया। डॉक्टर शिव सरीन सर एंड डॉक्टर रणदीप गुलेरिया जी सर, डॉक्टर वी.के. पॉल साहब, डॉक्टर सुरेश शर्मा जी, डॉक्टर नरेश त्रेहान सर एंड डॉक्टर देवी प्रसाद सेठी जी और हमारे अपने प्रिंसिपल एवं नियंत्रक वाइस चांसलर RUHS राजस्थान हेल्थ यूनिवर्सिटी के कुलपति महोदय, जिनके अथक प्रयासों से आज का ये स्वर्णिम दिन हमारे हिस्से में आया है। डॉक्टर सुधीर भंडारी सर के लिए एक बार फुल ऑन एनर्जी वाली जोरदार वाली तालियां आप सबकी तरफ से चाहूंगी। सहजता सादगी आपकी पहचान है और चिकित्सा के क्षेत्र को, राजस्थान के इस नाम को चिकित्सा के क्षेत्र में विश्व स्तर पर दिलानी आपको पहचान है। ऐसी ही इस सोच से आज आपने इस आईपीडी टावर और हृदय रोग संस्थान के भूमि पूजन को हम सभी के बीच में यहाँ आपने ये पल हमें दिए और आगामी 30 महीनों में ये कार्य पूरा होगा और माननीय मंत्री महोदय ने ये आश्वासन भी दिया कि बहुत जल्द ये हम सभी के लिए एक ऐतिहासिक टावर भी बनेगा। हेलीपैड जैसी सुविधाएं, वर्ल्ड क्लास चिकित्सक सुविधाएं और ऐसी सुविधाएं जिनमें एक नया आयाम स्थापित होगा। तो लीजिएगा अब आगे बढ़ते हैं बिना किसी देरी के। मैं प्रीति सक्सेना यहाँ उपस्थित सभी चिकित्सक, शिक्षक, चिकित्सक रेजिडेंट, पैरामेडिकल नर्सिंग कर्मी, छात्र व अन्य सहायक कर्मचारी, अधिकारीगण, सभी कर्मचारी संघ के अधिकारीगण एवं आगंतुक महानुभाव एवं मीडिया कर्मी और उपस्थित प्रत्येक व्यक्ति का तहे दिल से स्वागत करती हूँ, अभिनंदन करती हूँ। एक बार पुनः आप सभी के लिए जोरदार तालियां होनी चाहिए। मंच पर हमारे बीच में उपस्थित हैं पद्म भूषण सम्मानित प्रोफेसर डॉक्टर शिव कुमार सरीन सर, जिन्हें हम यहाँ सुनने जा रहे हैं। एक बार सर के सम्मान में जोरदार तालियां आप सबकी तरफ से होनी चाहिए। सर का परिचय मैं आप सभी के बीच में रखने का प्रयास करूंगी, बाकी विस्तृत रूप से डॉक्टर सुधीर भंडारी सर हमें सर के बारे में बताएंगे, लेकिन कुछ खास बातें मैं आप सभी के साथ शेयर करने जा रही हूँ। प्रोफेसर डॉक्टर शिव कुमार सरीन सर, सीनियर प्रोफेसर, कुलपति ILBS इंस्टीट्यूट ऑफ लिवर एंड बिलियरी साइंसेज, फॉर्मर चेयरमैन बोर्ड ऑफ गवर्नर्स MCI, गैस्ट्रोएंटेरोलॉजिस्ट एंड एपिटोलॉजिस्ट, नैदानिक नवाचारों में अग्रणी हैं आप। डॉक्टर सरीन एक प्रतिष्ठित जर्नल हेपेटोलॉजी इंटरनेशनल स्प्रिंगस्टन संस्थापक हैं और मुख्य संपादक हैं। आपने विशिष्ट क्षेत्रों में अधिकांश प्रतिष्ठित पत्रिकाओं में संपादकीय कार्य किया है। आपको हेपेटाइटिस और लीवर के सिरोसिस और इनकी जटिलताओं के रोगियों के प्रबंधन के लिए बड़ी संख्या में प्रासंगिक और नए प्रोटोकॉल देने के लिए विश्व स्तर पर श्रेय भी दिया जाता है और आपको भारत का तीसरा सबसे बड़ा नागरिक पुरस्कार पद्म भूषण से भी सम्मानित किया जा चुका है। शांति स्वरूप भटनागर पुरस्कार भी आप ही को दिया जा चुका है। तो सर के लिए जोरदार तालियां होनी चाहिए। और मैं सर के परिचय के लिए रिक्वेस्ट करूंगी डॉक्टर सुधीर भंडारी सर से, और साथ के साथ मैं रिक्वेस्ट भी करूंगी कि हमारे बीच जो अदर मेडिकल कॉलेज से प्रिंसिपल्स हैं वो भी हमें मंच पे ज्वाइन करें। सर आप होमली रिक्वेस्ट कर दीजिए अदर प्रिंसिपल से।
Can I request Dr. Rathore, Dr. Salim, Dr. VB Singh and other my colleagues from medical colleges to be on dais? Good afternoon. It's been a great pleasure to have Dr. S.K. Sareen with us. He is one of the alumni of SMS and who has made his mark not nationally but at international pedestal. Dr. Sareen has been very kind, and we are really humbled and honored that in spite of his busy schedule, we made a small request to him and he considered to be a part of our IPD Tower foundation stone laying ceremony. It is a very difficult task to introduce Dr. Sareen because he is absolutely a bundle of virtues, qualities, and academic excellence. But this is my moral duty to fulfill the protocols of introducing him formally. Dr. Shiv Sareen is a Vice Chancellor of Institute of Liver and Biliary Sciences, which is his baby. Dr. Shiv Sareen is a Senior Professor and Vice Chancellor at the Institute of Liver and Biliary Sciences, New Delhi. He is an astute clinician, gastroenterologist, hepatologist, a pioneer in clinical innovations, and gifted teacher. He is an alumni of SMS Medical College. That is a sense of pride we have. Dr. Sareen has contributed immensely in the field of liver diseases. He is an instrumental in changing the nomenclature of hepatitis B carrier to chronic HBV infection. The treatment options and pathogenesis of these diseases have been greatly advanced by his work. Dr. Sareen is credited with the launch of hepatitis B vaccine program in India. His approach for primary prevention of varicose bleeding by bad ligation has become the standard of care worldwide. Similarly, the management protocol on gastric varices and the nomenclature bearing his name as Sareen's classification of gastric varices was universally followed, and we need to give absolutely compliments to him. He has more than 350 international publications to his credit, including the New England Journal of Medicine, the Lancet, the Annals of Internal Medicine, Gastroenterology, and Hepatology. He has edited 11 books on the liver diseases, many of which are standard reference books, and contributed more than 69 chapters in the various medical textbooks. Dr. Sareen is the founder, chief editor of a prestigious journal, Hepatology International. He has been bestowed with Padma Vibhushan by Government of India. He is also the recipient of several other awards, including Santi Swarup Bhatnagar Award. I feel very happy personally, and on behalf of my institute, I extend very welcome to this festive day of the SMS. We extend profuse thanks for having accepted our invitation. Over to Dr. Sareen to give his presentation and address all of us. Thank you very much.
थैंक यू सो मच सर. एक बार क्लैपिंग होनी चाहिए और आप सबकी तरफ से सर का वेलकम. जैसे कि अभी सर ने कहा है कि हमारे अपने जयपुर से आपका बहुत अच्छा नाता है, आप ओल्ड एलुमनाई भी हैं. हम आपका स्वागत इन शब्दों से कहना चाहेंगे. अक्सर हम कहते हैं सोनेरी धरती जठे चांदीर आसमान, सोनेरी धरती जठे चांदीर आसमान, रंग रंगीलो रस भरो मारो प्यारो. आज से हम बोलेंगे निरोगी राजस्थान. सर का जोरदार तालियों से स्वागत है. सर हमें बताने वाले हैं फैटी लीवर के बारे में. थैंक यू so much, sir. Over to you.
Thank you, Dr. Bhandari, Dr. Singh, Dr. Salim, Dr. Rathore, and my senior, Professor Sagar Pangadia. It's a pleasure to see many of you, my colleagues and seniors. वैसे दोपहर में 3 बजे लेक्चर के लिए मुश्किल है, और वो भी खाना खाने के बाद. It's not easy. पहली बात, I will compliment Sudhir and the team of 7 additional principals who have worked very hard to make this day happen. It is unbelievable, I can't tell you. As I was sitting and saying in the morning, it is the second innings in medical field in Rajasthan. 47 SMS started, and today is the second inning. Maybe you should keep your birthday on 5th of April, Sudhir. It will be a very good day to remember the whole event started today and the whole team. I studied in SMS. Those were glorious days. My MBBS and MD both. Those days, good thing was a person who was 1 year or 2 years senior to you was the best teacher. 5 or 6 in the evening you finish your work, and 7 to 8 there would be rounds by the seniors who will teach you. And in addition will take you to the neighboring place to have some tea and pakoras. I don't remember the name, but just outside on the left-hand side of SMS building, there used to be tea stall, and where we all were taken by the senior. Is this tradition still there, Gaurav? Is very much there? Oh. I'm not here to educate people. All of you are senior doctors and physicians, but I just want to drive a small point, which I learned over last 2 decades about liver and how it affects the rest of the body. I saw the exhibition here. Exemplary work is going to come. So my talk may add to the concept of Nirogi Rajasthan. I bring greetings from ILBS. The first question you have in mind: do I have fatty liver? Should I worry? And how to fix it? Those who know they have fatty liver can raise hands. डरो मत यार, कोई देख नहीं रहा, कोई इंश्योरेंस वाला नहीं पूछेगा. At least 5, 7, 10 maybe have raised hands. Others don't know, they may have it. Okay. Should I worry? Raise hands. Nobody is worried. How to fix it? Okay, we'll go further. So this is the bottom line in my mind for next 2 decades. 2 decades. Liver fat flames and frames the body. Your whole body frame is determined by this single line. I will try and convince you. Liver is the largest organ. The only other organ which can be bigger than liver is your bacteria. Your gut microbiome is the biggest immune gland, and it is your chartered accountant. What comes in must go out, otherwise income tax raids will come. It's your chartered accountant. If you spend more, you never pay tax. If you accumulate more, you pay tax by blood pressure, heart attack, or something. I know all of you know this diagram, but I just want to stress for 1 minute because this is the key for human life. First of all, liver tolerates everything, but there is a limit to tolerance. After that, it will give up. You all know it synthesizes. You all know it causes detoxification. It will, clotting factors are all by liver, iron. But do you remember that your blood sugar is controlled by liver? It's not by pancreas. So if you remember this, you will remember the rest of the talk. I hope I can make sense to senior peoples like this. All right. So what damages liver? Fat, alcohol, and the virus. You all remember this. You remember it? Aishwarya Rai? And you remember this guy? So you will never forget that alcohol causes fatty liver. And fatty liver means 10% or more of liver is fat. And this is alcoholic steatohepatitis, ASH. You will never forget ASH. At least I can't. And you add non-alcoholic is NASH. And this NASH is now our major problem. So there is hepatitis. So normal liver, 5% fat, more than 10% is fatty liver. I hope everyone broadly can conceptualize. And it is because you collect more or your genes are bad. Now, this is a very complicated diagram, and I'll make it very simple. This is the core of the whole talk. Let me try and go over this with you. So, this is the liver, whether alcohol or fat. When you have fatty liver, means more than 10%. So all these white cells, and I know we have pathology professors here, all these cells are having fat. They are not normal. So this is a normal hepatocyte and this is a fatty hepatocyte which has fat. Now what is the problem if you have fat? These are not normal cells. The moment your body has something abnormal, it will send immune cells. These immune cells will try to kill this. यार ये कहाँ से आ गया इतना मोटा फैट वाला सेल, इसको मारो. आपके T cells, NK cells, वो सारे जाके उसको मारेंगे. And that is what is your hepatitis, steatohepatitis. Fat-induced hepatitis. Then there is a healing process. कभी तो injury खत्म करनी है. You get fibrosis. This is wound healing. Then you get cirrhosis and sometimes even liver cancer. But the journey is bilateral. One is this side and one is this side. And this is the crux. When you have more than 10% fat, insulin cannot get into the hepatocyte. वो ATP बना ही नहीं सकती, Krebs cycle चल ही नहीं सकता. It cannot work. So you need more insulin, you need more insulin. Every day, if you have fat in the liver, you will make more insulin, and that is simple terms insulin resistance. You don't have to have big definition. Simple definition is you are unable to get insulin into the cell for utilization. So then you need every day more insulin. You end up having diabetes. So in a way, type 2 diabetes is a liver disease. If you remove fat, you will not need more insulin. If you will not need more insulin, you may prevent diabetes. Let's go further. When you have this fat will go into your blood. It will spill out. And you have high cholesterol, high triglyceride. Person will say, यार तू खाता बहुत है, बहुत मिठाई लेता है, बहुत fats खाता है. That's not that. This is your extra fat in the liver, which will spill in the blood, and you have high cholesterol. तो आप अपना blood test कराने जाओ, मालूम पड़ा साहब cholesterol 270 है. You definitely have fatty liver. You have high triglyceride, you have fatty liver. And these are new definitions. So when you have high fat, it will go onto your arteries, you get atherosclerosis, you get heart disease, you have stroke, and of course gallbladder stone. So the first stop from liver is to gallbladder. Extra fat will go to gallbladder. So everybody with gallbladder stone has fatty liver because it is bad bile. So gallstone is a liver disease. It's not a disease of gallbladder. So having this diagram, I just want to convey you, one is the journey of fat and the liver alone. One is outside liver where you have diabetes, you have dyslipidemia, blood pressure, heart disease, stroke, and gallbladder stone. तो अब ये रेलेवेंट है फ्यूचर के लिए? नहीं. इज दिस रेलेवेंट आईपीडी टावर के लिए? ठीक है, आईपीडी टावर को बचाना है, ज्यादा मरीज नहीं आए, तो जस्ट अंडरस्टैंड दिस. ऑल राइट, आई होप आई कैन कन्विंस यू. द नेक्स्ट क्वेश्चन is my liver healthy or on fire and inflamed? You can see that this liver is on fire. This liver is not on fire. These cartoons were made for an international cartoons competition on liver. Everybody knows my hemoglobin should be 15 or 14, whatever, for ladies. But do you know what should be a normal SGPT level? सब labs में 40 है, 40 international unit. And I'll tell you why 40 is wrong. If you get this concept, you add 5 years in your life. 5 साल उम्र बढ़ जाएगी at least. So at ILBS, we use 30 for male and 19 for female. These are American standards. All the US labs use 30 and 19. My suggestion is normal ALT is 30 for male, even less than that is better. Let's look at this. If your SGPT is high, this is Framingham study, you have diabetes risk and you develop diabetes 5 to 20 times. उन्होंने क्या किया? Grandfather, father and the child. The moment child is born, they were following. Those children who had high SGPT were followed. Those who had high SGPT, by the time they were 20 years to 25, they developed diabetes. This is Framingham study. Many such studies have come. So high SGPT is bad even at childhood. Now this study is a Korean study. I want you to see this very carefully. उन्होंने क्या किया? 1,42,000 हेल्थ इंश्योरेंस वालों को लिया कोरिया में 1990 से 92. They were all between 35 and 59. They followed them for 8 to 10 years. Those who had SGPT or ALT less than 20, all cause or liver death was 1. The moment SGPT starts going to 29, liver deaths increase up to 39 9 times. Heart disease also increases. By the time your SGPT is 60, 70, your risk of liver and other diseases many-fold increases. So if a 25-year-old boy has an SGPT of 80, his first heart attack is at 36. SGPT is a reflection of inflammation of the body. This slide only tells you liver-related and non-liver-related deaths. So, if your liver has fat, it is a mark of flame all over body. पूरी शरीर जल रहा. It's a marker of whole inflammation in the body. This is what I want to convey. So, how do you find out easy? SGPT high है, भाई गड़बड़ है, उसको ठीक कर लो. Hemoglobin पता है? SGPT is your next level of assessing it. So this is one more time, high SGPT takes you to diabetes, so prevent it. So SGPT also correlates, as I showed you, with fatty liver, lipids, diabetes and the risk of diabetes, blood pressure, heart disease and the risk, all cancers. Every cancer, liver, breast, prostate, may not be to lung that much where smoking comes in. How many of you have high SGPT? Can raise hands? Don't mind. Only 1, 2, maybe 5. If you do not know, get your SGPT. If you want to live 100 years, how many of you want to live 100 years with good health? Raise hands. यार 100 साल नहीं जीना चाहते हेल्दी रह के? दोनों हाथ खड़े कर देता मैं तो. बहुत है, अब सबके खड़े हो गए. If you want to live 100 years, take from me, your SGPT should be 10, not about 10. 10 is the SGPT of a healthy 10-year-old child. If you want to live healthy, keep your SGPT at 10. If it is 15, 20, it's not good. All right, let's go further. So what is the central thought of all what I have said? The central thought is liver fat precedes, it flames, causes diabetes and heart disease. Do you agree with this central thought? Manisha is agreeing. Monica agrees. All right. So now let's look at this person. Fat in the liver is bad. He is eating more. He is inactive. He is obese. With this, he gets fatty liver, high SGPT. He gets diabetes. His adipose tissue is hypertrophied. He has high lipids. He has inflammatory markers. He gets blood pressure. He gets heart disease, lipotoxicity. And all this can be prevented. I do not know if I have a slide on this. Yeah, I have. This is a very important slide. हम लोग जब छोटे थे, पढ़ते थे, तो सबसे बढ़िया घेवर बनते थे LMB पे. तो LMB में जाके घेवर खा लो, तो मतलब महीने भर का काम हो जाता था. कई बार अब मैं लुक बैक करके देखता हूँ कि many of those people who were making, they were healthy even at the age of 80. All people who are obese are not unhealthy. And this slide tells you, this is next generation slide, and I want to share with all the science-loving people. Here is the halwai of first generation. Very obese, 110 kg. His genetic predisposition is this much. उसके father को कुछ नहीं था, mother को नहीं था. He is the first generation. He has a metabolic syndrome, but very little genes, and environment plays a major role. Here is the grandchild of this person. The grandchild. He has a genetic predisposition. वो पानी पिएगा और घी बन जाएगा. This is exactly what happens to the grandchild of this person. He will eat little bit, very little role of environment, and very little role of epigenetics or metabolism. So just remember, so now obesity is of 4 types. Obese, metabolically healthy. Obese, metabolically unhealthy. This may be obese but lean. He is lean but metabolically unhealthy. He is lean, metabolically healthy. So this guy, if he is lean, number 1, he is lean and metabolically healthy. If he continues, all the children will be lean and metabolically healthy. This guy is obese and metabolically healthy. His children will become metabolically unhealthy, whether they are overweight or normal weight. Now, do I have fat in the liver? You have to come to SMS to get this test done. But can you do it yourself? This is the new diagram. It's not complicated. Just remember, this is now the new name for NAFLD is MAFLD, metabolism, metabolic dysfunction associated fatty liver. Forget the name. Remember this, anybody who has diabetes has fatty liver. No questions asked. These are accepted. Second, anybody who has BMI above 23. How many of you have BMI above 23? Raise hands. अभी भी नहीं, डर के मारे नहीं उठा रहे हाथ. Anyway, just a message. Anybody with a BMI above 23, overweight or obese has fatty liver. So what are the categories now? Diabetics and overweight, fatty liver. Central part is lean or normal weight less than 23. जो हम पहले metabolic syndrome के criteria थे 5, now they are applied for lean or normal weight. These are the new changes in metabolic medicine. So diabetics, overweight and obese have fatty liver. Now ask yourself these 7 questions. Am I having fatty liver disease? आपको कहीं SMS नहीं जाना, कहीं नहीं जाना. Ask this question, do I have a family history? My father, mother, uncle, sister, metabolic syndrome, diabetes, blood pressure, heart or kidney disease, liver, gallstone, cancer, obesity. और snoring, साहब रात को खर्राटे भरता है, दूसरे कमरे में सोना पड़ता है. डायग्नोज हो गया, कुछ नहीं करना. Or polycystic ovary. All these people are likely to have fatty liver. Next, height minus 100. Height है 170 सेंटीमीटर, उसमें से 100 घटा दो. If your weight is 70 kg, you are okay. If you are a female, 5 और 105 घटाना पड़ेगा. और if you have a family history, तो 5 और घटाना पड़ेगा. Your weight is 170 minus 110. If you are above that, you may have fatty liver. Very simple calculation. Height minus 100, 105 or 110. Ultrasound, everybody can do. Fibro scan may or may not be. Do your SGPT. अच्छा आपका कोलेस्ट्रॉल ट्राइग्लिसराइड हाई है, फैटी लिवर है, सोचने की बात ही नहीं. You may not find on ultrasound, but if you do a biopsy, you will have fat in the adequate fat. And if your blood sugar is high. Is this okay? Is it complicated? तो नहीं है. Is this all right? Okay, all right. Now, हम लोग साउथ एक्सटेंशन में जाके जीन्स खरीदते हैं दिल्ली में. जयपुर में कहाँ जीन्स खरीदते हैं? दिल्ली, जयपुर में what is the best place to buy jeans? जीन्स कहाँ खरीदते हैं? Where? Raja Park. I remember Raja Park. So if you teach the tailor and your children that don't fit jeans on you, fit yourself in the jeans. Kaam khatam. If you fit the jeans on you, you will get 36 inch, 38 inch, 40 inch, 42 inch. कोई मतलब नहीं. So teach them and teach your tailor कि यार मेरा लड़का है ना, उसकी तू बनाना ही मत जीन्स. तू तो उसे कहना पहले तू इस लेवल का हो तब तेरी जीन्स बनेंगी, नहीं तो नहीं बनेंगी. Males 90 or less, females 80 or less. So you don't need to have fatty liver worries. I know it is difficult, I know it is tough, but we have to be there. Teach your barber. और नाई को सिखा दो कि यार कोई तेरे पास बाल कटाने वाला आए और उसके ये वॉर्ट्स हों गले में या ये लाइंस हों तो तू रेड बटन दबा देना. This is the easiest way I feel you can detect fatty liver. He will have acanthosis nigricans. You agree? This is a good picture. सारी चीजें नहीं हो, वॉट पता लग जाए, तिल है उसके. पहले वो मंगल देखते थे, राहु केतु देखते थे, है ना, शादी से पहले कि यार वो शनि उस ग्रह में है, राहु इधर है, अभी यार इसके तिल है. This is one of the strongest indicators of having fatty liver disease. So I have told you, you communicate with barbers and tailors, 10% तो fatty liver खत्म हो जाएगा. Of course, you get an ultrasound. This is your skin. This is your underlying subcutaneous fat. This is the liver. This is the kidney. Don't compare kidney and liver. Compare liver and spleen. If your liver and spleen are brother sister, they should have same color. But here it is white like fat. This is grade 2 fatty liver. It's 1 minute job. This is Fibro Scan, a simple ultrasound machine. I'm sure Gaurav and the whole gastro team does it. So this gives you fat and this gives you fibrosis. I'll tell you basic principle. if the sound will go into the fat and how it returns. It is controlled attenuation parameter, CAP. So sound goes and comes back. The slowness of the sound will tell you how much fat. It should be less than 250. It is less than 250 means 10%. 250 to 290 is about 30% fat. Above 290 is 30% and more fat, which is not acceptable. This is your fibrosis. Just see the principle. The time in millisecond. Suppose sound comes, वो लकड़ी को hit करेगी, जल्दी वापस जाएगी. हाथ को करेगी, it will take long time. So the time taken is normally 60 milliseconds. 40 milliseconds, it is a stiff liver, hard liver. 8.5 is stage 2 fibrosis. In 1 minute, you find out how much stiff the liver is. अच्छा, liver stiff है, heart stiff है, kidney stiff है, brain stiff है, lungs stiff. So today, for me, I'm extremely cynical of what I'm saying, but today, if somebody has this, I will say you are unhealthy. Anything above 8 is not accepted. So in 1 minute, you find out fat and your fibrosis, and you cannot accept it. Now, how do you treat? I'll just take 5 more minutes. I'll not make you sleep. First is change the approach. When I said कितनों को fatty liver है, attitude तो बदलना पड़ेगा. Do you agree attitude बदलना पड़ेगा? If you agree, then raise hands. अब तो सबने हाथ खड़े कर दिए. So if you are there, I have nothing else to do. The health of this Rajasthan people will be good. And just remember, liver fat is an alarm. It doesn't mean कि fire लग गई है. It's an alarm of smoke. This map is to show you, this is a nature paper, countries with more than or equal to 30% fat. And you can see India is 30%. 1 in 3 has fatty liver. So what is the precision treatment? Avoid insults to liver in the form of weight. Give support to liver by exercise and food. Now they see the difference. Weight se kya hota hai? If you have this, your mind is like, this guy is cool. I've already told you the family and reduce if family history is there. So focus on health. Now, it all depends on the plate. What you eat, how much you eat, and when you eat. You all know it. I'm not going to say much, except to say these are good things. That includes apple and ghee. You will say, यार घी खाने से तो मोटे हो जाएंगे. घी से तो सबका वेट बढ़ेगा, पर वो घी को जलाना पड़ेगा यार, वो तो मेहनत करनी है. Ghee is pure ghee, desi ghee makes your lactobacilli grow by 20 times. Of course, walnut, omega-3, haldi, which has anti-TNF, no water with food, so your food can churn, and coffee. Now, how much and when you eat is the Nobel Prize for 2017. The clock genes, aapki dincharya. The Nobel Prize in medicine went to the guy who said, what time you sleep is determined by your bacteria. Don't let them be. Based on all these data, India becomes the first country where fatty liver is part of the NCD program, National Non-Communicable Disease Program, in 2021. What is the relevance? If you want to see less kidney disease, less stroke, less blood pressure, remove fat. Liver was like an orphan. So now at least the government, and this is the first government of India which has recognized last year. This is my last slide. Where there is a will, there is a way. We say, साहब हमसे कुछ नहीं होता, हमारे पास कुछ नहीं है. I think, in my opinion, make liver healthy, change India. And today I feel extremely privileged that such people, including my seniors, are sitting and I'm able to communicate. And I want to thank Dr. Bhandari Sahab, all of you, for having given me time to think what I feel is very important. Thank you.
Thank you so much, sir. और हमारे साथ में राजस्थान से कुछ लोग जुड़े हुए हैं, चूरू और धौलपुर से. अगर आपका कोई सवाल है तो आप पूछ सकते हैं, प्लीज. लाइव कनेक्ट कीजिए प्लीज, टेक्निकल टीम.
हेलो.
So once again, I'll request you all, please big round of applause. थोड़ी सी तालियां हो जाएं. हम लाइव कनेक्टिविटी आप सभी के बीच में के माध्यम से जुड़ेंगे और यस, चूरू से जो टीम जुड़ी हुई है, आपका कोई सवाल है प्लीज?
जी सर, गुड आफ्टरनून मैम. हेलो हेलो.
Very good compliment. Sorry, you have a question, please?
आपसे निवेदन है कि आप अपना प्रश्न एक बार दोबारा दोहराएं. चूरू की टीम, सबसे पहले आपसे निवेदन है कि आपका जो प्रश्न है वो आप दोबारा दोहराएं. बांसवाड़ा कनेक्ट हो रखा है. बांसवाड़ा की टीम, आपका कोई प्रश्न?
हेलो, टीम बांसवाड़ा, सबसे पहले अपना परिचय दें. टीम बांसवाड़ा.
ये सर बांसवाड़ा, मैं सीएमएचओ बोल रहा था सर, और मेरे साथ में ऑफिस के सभी ऑफिस.
हाँ, तो आप डॉक्टर सरीन साहब से कोई अपना क्वेश्चन करना चाहते हैं तो इनसे जरा पूछिए.
यस सर, कुछ.
गुड आफ्टरनून सर.
हाँ, बांसवाड़ा.
हेलो. गुड आफ्टरनून सर.
Yes, sir.
सर, मैं वॉलीबॉल गेम खेलता हूँ, तो पहले कंटिन्यू पूरे 3 सेट खेल पाता था, लेकिन अभी पिछले 3-4 महीने से अभी 2 सेट में मेरे को थकान सी महसूस होती है और पेन भी होने लग जाता है. तो इस स्थिति में क्या करना चाहिए?
थोड़ा समझ में नहीं आया सब पूरा मुझे.
सर, मैं गेम्स खेल रहा था वॉलीबॉल
जी.
तो तीनों सेट पूरा खेलता था कंटिन्यू में, लेकिन पिछले कुछ समय तो 2-3 महीने से मैं 2 सेट में ही थक जाता हूँ और पेन होने लग जाता है चेस्ट में थोड़ा, और रात में भी कभी पसीना से पेन. तो क्या सावधानी रखनी?
अभी एज कितनी है आपकी?
39.
2 ही सेट खेलते हैं. तो खेलना पड़ेगा. एक बार चेक करा लो हार्ट, अगर आपका कोई प्रॉब्लम नहीं है.
जी सर.
इसमें थकान का एक कारण बड़ा इंटरेस्टिंग है. वेट ज़्यादा होता है, सपोज समबडी इज ओवरवेट, आपके लिए नहीं कह रहा हूँ, तो मसल्स 130 से 200 टाइम्स मोर ऑक्सीजन ड्रॉ करती है. तो आप थोड़ा सा खेलेंगे एंड यू फील टायर्ड. यार, मैं सीढ़ी चढ़ता था पहले 10 तल्ला, अब तो नहीं चढ़ सकता. तो यू विल फील व्हाई यू आर टायर्ड is not because your heart is weak, but maybe your muscles take more oxygen. This is very, very true. So muscle fatigue is related to your weight and the adipose tissue.
थैंक यू सर।
नमस्कार सर, मैं पीएमओ धौलपुर निवेदन कर रहा हूं सर। देयर इज अ क्वेश्चन फ्रॉम माय कलीग।
जी सर। जी सर।
हेलो सर, गुड आफ्टरनून सर। मैं धर्मेंद्र बात कर रहा हूँ सर धौलपुर से। मेरा आपसे एक क्वेश्चन है सर कि हमारे यहाँ ज़्यादातर लोगों का मानना है कि पीलिया को हम झाड़ फूक से ठीक करवा सकते हैं। सर ज़्यादातर लोग यही करते हैं हमारे यहाँ सर, तो आप सर इस बारे में थोड़ा क्लैरिफिकेशन दें सर।
नहीं, झाड़ फूक का असर तो पड़ता है साइकोलॉजिकल, मतलब विल पावर बढ़ जाती है उससे, है ना, फाइट करने की शक्ति, पर बीमारी नहीं ठीक होती, विल पावर बढ़ सकती है उससे। आप लोगों को कहें, वी आर नॉट अगेंस्ट झाड़ फूक, आप करिए, बट साथ साथ इलाज भी करा लीजिए। मेरे पास अभी एक मरीज भर्ती है, वो माला बना के लाया, धीरे 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 उसकी माला यहाँ तक आ गई।
जी सर।
वो बड़ा खुश था, पर उसका बिलीरुबिन 36 से 34 भी नहीं हुआ, बल्कि 39 हो गया।
सर मेरा बिलीरुबिन भी सर एक बार 45 हो गया था सर। मैं ILBS में ट्रीटमेंट लेने गया था, डॉक्टर मुकेश जी से लिया था मैंने सर ट्रीटमेंट। आपका अपॉइंटमेंट नहीं मिला था सर।
अरे बट ये झाड़ फूक वाली बात जो है, ये थोड़ा सा लोगों को बताना पड़ेगा कि इट इज गुड फॉर फीलिंग गुड,
जी
बट नॉट गेटिंग बेटर।
जी सर, मैंने भी करवाई थी, लेकिन मुझे कोई बेनिफिट्स नहीं मिले थे सर। जी सर।
थैंक यू सर।
थैंक यू
सर।
Thank you, Team Dholpur. Now, I think Team Churu is there, na? From Churu.
हाँ जी सर, नमस्ते।
नमस्ते
सर, मैं वो पित्त की थैली निकालने के बाद दैनिक खानपान और दिनचर्या कैसी होनी चाहिए सर?
किस एज पर है पर्सन?
58।
कितनी एज के आदमी की गॉल ब्लैडर निकाला गया?
50 साल के बाद सर।
हाँ, तो उससे पहले तो ये हिस्ट्री में पूछिए कि उसकी मदर को गॉल ब्लैडर में स्टोन है कि नहीं।
ठीक है
फिर नहीं, सबसे पहला सवाल। दूसरा, उसके बच्चों को गॉल ब्लैडर का स्टोन होगा, ये 5 गुना ज्यादा रिस्क है। सपोज उसको 50 पे हुआ तो नेक्स्ट जनरेशन 40, 35, उससे नेक्स्ट जनरेशन मे बी 20 years. This is the way gallstone walking genes will do. अब उसे खाना क्या है? हमारे बॉडी में 2 सर्कुलेशन है, एक तो हार्ट का और एक लिवर का। लिवर वाला एंट्रोहिपैटिक है, लिवर से इंटेस्टाइन। तो जो हमारा पित्त है, दैट इज अवर ब्लड, इज योर सेकंड सर्कुलेशन। फर्स्ट सर्कुलेशन इज ऑफ ब्लड। एंट्रोहिपैटिक सर्कुलेशन धीरे धीरे एडजस्ट हो जाता है। विद इन 3 months योर एंट्रोहिपैटिक इज कूल, इट डजंट रन फास्ट, बॉडी adapts, nothing happens. So removing gallbladder stone डाइजेशन पे, डाइट पे कोई असर नहीं। सबसे बड़ा असर है कि जिसको आज गॉल स्टोन हुआ है, 10 साल बाद उसका ब्लड प्रेशर, सिरोसिस, लिपिड्स, कैंसर का रिस्क इतना ज्यादा है। तो एनीबडी गेट्स गॉल स्टोन, प्लीज टेल हिम यू आर हाफ वे ऑलरेडी फॉर मोर डिजीजेस। Gallbladder stone is a disease of liver, it's not a disease of gallbladder, so it is a warning of high order. Okay? And diet पे कोई असर नहीं।
सर नेक्स्ट क्वेश्चन ये था सर, हेलो,
हाँ
सर दिनचर्या कैसी होनी चाहिए कि लीवर ठीक तरह से काम करे, ठीक तरह से कार्य करे सर?
वेट जितना होना चाहिए उससे थोड़ा कम, 5-10 पैसा कम ही हो तो इनकम टैक्स वाले नहीं आए। अब आफ्टर 41 meal a day, third is as much natural as you can. There should be no fat in the liver. You may be overweight, but get yourself checked कि फैट नहीं। और ALT, SGPT 20 से कम, 10 तो ना हो तो 20 से कम होना चाहिए। बाकी तो जीन्स खराब हो तो कुछ नहीं कर सकते। वो कहते हैं साहब 25 साल का था, पतला दुबला था साहब, कुछ भी नहीं था, साइकिल चला रहा था साहब, हार्ट अटैक हो गया। but you have to trace the whole history of 5 generations. Why at 25, a lean and thin person got a cardiac arrest? So, diet में कुछ
Thank you,
Thank you, sir.
Team Churu. Now, I think a question, sir, from audience. I'll read out. एक WhatsApp आया. Sir, a doctor of middle age, or I think not middle age is 56 years. He wants to know which one is better, whiskey, rum, beer, or red wine. He is sitting in the audience, but he is not asking the question. He WhatsApp me.
सबके दिल की बात आपने कह दी. जिसने भी कही है वो सबके दिल की बात है.
नहीं सर, दिल की बात दूसरा क्वेश्चन है उसका. पहले ये बताएं आप. दूसरा दिल की बात और है उसकी.
Okay. मतलब अगर पीना जरूरी ही है.
Yes sir.
मतलब ये उसका
Yes,
कहना
sir,
है
yes,
कि
sir.
पीना जरूरी है.
And he is diabetic also.
फिर तो करेला और नीम चढ़ा.
Still he wants.
अगर पीना जरूरी ही है तो रेड वाइन इज द बेस्ट एंड द सेफेस्ट. बट वो कहोगे रेड वाइन में साहब मजा ही नहीं आता, तो अभी तो कुछ और पीना पड़ेगा. वेल, इफ यू ड्रिंक 20 grams means roughly 1 drink to 2 drinks a week of any of these, it's all right. Unless you are overweight and you are diabetic. So you fall into that category of diabetes. For diabetes, risk estimates are very bad. But ठीक है, आप किसी को बताओ नहीं, वाइन पी लो, हफ्ते में एक बार एक ड्रिंक ले लो, that's all right. Either wine or that. But don't go beyond it to be on the safe level.
Sir, the second question is, what should be the right quantity?
Sudhir, what should be the right quantity?
I think it's a very interesting question. There are two components, the scientific part and the general part. One thing should be very clear, that all alcoholic drinks have a calorific value, which Dr. Sareen sir will agree with me. And probably one normal glass of wine, what Dr. Sareen has permitted, would give you around 125 calories. Whiskey ka 30 ml is again 125 calories. So you take 2 to 4 packs, etc. And most of these drinks are coupled up with the snacks, which are fried snacks, etc., etc. So coming back to the scientific aspect of exact quantity, probably what Dr. Sareen proposed once a week, which is an optimal thing, taken not beyond that, and also limit to your calorie content depends upon what has been your weight, what has been your BMI, because all alcoholic drink coupled up with the snacks makes you feel put on weight. Whenever you are in excess of 7,000 calories, suppose you require 2,000 calories and you have been consuming 2,500 calories a day, when you become in excess of 7,000 calories, cumulatively you put on 1 kg of weight. And putting on weight, probably no one could have explained better than what Dr. Sareen explained so beautifully, that it is a fatty liver and everything, whole system gets jeopardized if you are overweight, and it is better to have underweight. So drinking should be taken in perspective of putting on weight and increasing BMI. Rest, the ethanol itself has certain side effects on the liver and other organs, which no one can better than what he said. But I think what you propose, sir, that once a week in an optimal could be the upper limit, but provided you are healthy. If you have comorbid conditions, probably we need to avoid that also. Am I correct, sir? Come.
Any other question? Yes, Dr. Vandana.
Hello.
Yes, you can ask.
Namaskar, sir. Sir. Namaskar, sir. Sir, is there any variation between developing fatty liver or cirrhosis between male and female?
Yes, there is definitely a predisposition. because female's fat is very, very indolent. It's not easy to burn. It's kind of adiposopathy, and the hormones, especially the estrogens. Now there is a Nature article, 2021, the dichotomy of microbes. So what you eat is eaten by the microbes. So males and females, right after 3 years of age, have distinctly different microbes. And therefore, their fat distribution and burning is much more. So they have more visceral, more of fat which is white than men who have brown and other types of fat. One more thing is what you drink, you don't drink, your bacteria drink. ये आपको अंदाज है इसका? नहीं. वो कहते हैं साहब उसको तो एडिक्शन हो गया, वो छोड़ ही नहीं सकता. So what is the new therapy? Is fecal microbial transplant. You change your bacteria, आपका addiction खत्म हो जाता. This has been published in some of the best journals. Your addiction is related to your bacteria. उनकी आदत पड़ जाती है ड्रिंक्स को लेने की, तब सोते हो आप. This is not you. This is your bacteria which have become addicted. Those bacteria grow up which are fermenting more of sugar. And therefore you get it. So you change your bacteria, आपका addiction भी कम हो जाता है.
Thank you, sir. Any more question?
Sir, secondly, if fatty liver develops, sir, is there any definitive therapy for that?
Yes, what I told you was preventive. If you would like to lose fat, some of the good drugs are pentoxifylline, your Trental. It clears your liver. You can also use omega-3. Now the next generation drugs are coming, which are obeticholic acids or bile acid agonists. So some of these drugs are in experimental phase. My best approach is to give pentoxy, sometimes metformin, which works very well for these patients, but no definite drugs. If dyslipidemia is there, then you can use saraglitazar. If you also have diabetes plus dyslipidemia, pioglitazone is a good drug.
One question to Dr. Sareen. The commonest question, most of the people who have fatty liver or jaundice, they have a question about types of oil they need to consume, which you allow. There are different kinds of oils available in market. They are very well marketed: polyunsaturated, saturated, monounsaturated, safola, groundnut. So a piece of advice to people who have fatty liver, the type of oil, and especially there are a lot of myths about diet in jaundice. Most of the time in a milder jaundice, you would say eat normally whatever you have been eating. Am I correct? So type of food in jaundice, and especially type of oil which you recommend in a case who is suspected. In fact, every second sonography reports fatty liver. So type of oil in fatty liver, what will you recommend?
Thank you, Dr. Bhandari. Sir, one more question. Please explain one meal a day.
Dr. Sareen, respond to sir.
So 2 parts, what oil and what diet in jaundice. So if it is obstructive jaundice, avoid fat. In non-obstructive medical jaundice, no restriction. Itching and others, itching is a protective phenomena of the body, so don't worry about itching. As far as fatty liver and oil, very little correlation. I have never stopped anybody from changing any fat. Yes, I think saturated fat is as good as unsaturated because it increases lactobacilli. But yes, you should burn it. The fatty liver person, if he can lose weight, he can eat anything. There's no restriction on that.
One more question. Patient with the fatty liver going to operate, what will be the outcome of this patient? Operate? Oh, yes.
If he is a donor, See, very interesting question which you have asked, and I will tell you. When you do the pre-anesthetic checkup and you say bilirubin is 1.2, so you get sometimes worried bilirubin badha hua hai. You take direct and indirect. Direct is 0.2, indirect is 1. This means this patient has fatty liver. Even you don't have to look at anything. Indirect, higher is a protective mechanism of the body against oxidative stress. So a higher indirect bilirubin means this guy has likely to have heart disease, has something else. Now you are operating. When you operate, his bilirubin goes to 2.5 or 2, you are worried. You will see generally it is indirect and not the direct bilirubin. Of course, if the patient has high enzymes or has low albumin or low platelets, then there is a problem. So there is a term called, now very recently, January 2022, compensated advanced chronic liver disease. Compensated advanced chronic liver disease, and for surgeons it is important, if you have platelets less than 150,000 or your Fibro Scan is above 15, liver stiffness, this guy has compensated advanced chronic. Just two criteria, platelet less than 150 and fibro liver stiffness above 15. So these are people you should ask some colleague to see before operating.
Dr. Bhandari.
I think it has been a wonderful deliberation. Out of box, can I ask you one question, sir, which will be of great interest to audience? There's been a lot of myths about people are known, if you have two kidneys, you donate one, the donor can lead a healthy life. In kidneys, there are two kidneys. Common man knows that if you donate one, you can lead a healthy life full term. But regarding livers, there are a lot of myths, lot of confusions, and a lot of people have less of clarity that they donate a part of liver. Can they lead the same quality and longevity of life? So could you give a message that yes, suppose such situation arises, and what is the quality of life a patient after liver donation, live liver donation leads to, and there are no risks to his life? Some throw on light for a common man, because people, even in family, when they are considered for cross-matching, they have a lot of reservations. So to what extent is a valid reservation, or what message you will like to give a probable donor?
It's a very important question, and thank you for making me share my thoughts. Like you go for a haircut, वो 4 हफ्ते में बाल वापस बढ़ जाते हैं. Same is true for liver. If you donate, nearly 40%, 50% of your liver, 60% of the liver, in 4 weeks, it will come back to the same size. It regenerates very fast. The quality of liver donor's life, 9 out of 10 is good for 10 years. The data is available of living donor up to 10 years comfortably. But you have to prime that donor before, भाई तू donate करेगा, महीना भर थोड़ा सा लेटेगा, फिर धीरे धीरे काम पे जाएगा. You know, if you haven't trained his mind, he will feel something has gone wrong. But if you have trained, if you have counseled him well, the quality of life, his physical activity, he can climb the mountain, he can do horse riding, he can play polo, he can swim, everything as anybody else. And today, the living donation has become very safe. Surgeons are very, very careful before they assess. So I think all of us, if needed, can give our liver without the right lobe of the liver, not the left. The left you can give easily without even thinking. Even right lobe, you can give major part of it. So what you give is 60%, you keep 40%. And that is good enough for us to regenerate fast. So I think living donor liver transplant, and we do, with all humility, about 100 liver transplants at ILBS a year. Unfortunately, we are doing well. And my desire is that SMS and other centers in Rajasthan to grow up. The first patient we did of liver transplant, 2010, was also from Rajasthan. And I hope that we can continue with this tradition and with your initiatives and the liver transplant centers and the surgeons and Soto, so well working Soto. Sky is the limit.
Thank you very much. It's wonderful to understand that yes, you can lead the same quality of life and there is regeneration. A expression from your has a great imprint on a people at large. So thank you very much, sir. It's wonderful what you said.
Sir, I think this is the last question. Can I take the last question? This is a question from a healthy female. She is writing that what quantity and the quality should, what quantity of the drink and the quality of drink is suitable for female?
Yeah, I know world has changed. Yeah, मतलब पहले कोई लड़की शराब पीती थी, सुनते ही नहीं थे. आपने सुना था अपने स्कूल?
Sir, I think we need to have a separate session on liver and drinks.
नहीं, पर वो अब मतलब सुनते हैं कि लड़की शराब नहीं पीती, मतलब वो सोशल ही नहीं है. आजकल उल्टा हो गया, ऐसा है ना, ऐसा कि वो लड़की को पीना ही पड़ता. अच्छा, मैं किस्सा बताता हूँ before I answer. So I had a patient about 25 years ago. This girl was drinking. उसका फादर दुनिया भर ले गया, डी एडिक्शन नहीं हुआ उसको, शादी हो गई उसकी. अब शादी के बाद में उसका बच्चा नहीं हो रहा था, 3-4 साल हो गया. फिर वो आई तो मैंने कहा कि तुम यू वांट अ चाइल्ड? आई सेड यस. आई सेड यू डू दिस विल हैपन, बट इफ यू ड्रिंक योर चाइल्ड में हैव फीटल अल्कोहल सिंड्रोम. वो क्या होता है उसको मैंने समझाया कि बच्चे का क्या होगा. कैन यू बिलीव उस रात के बाद में दैट गर्ल स्टॉप ड्रिंकिंग. द मोमेंट ही रियलाइज एज ए मदर मेरी जिम्मेदारी है, उसने शराब पीना ही बंद कर दिया. कहीं डी एडिक्शन में जाना ही नहीं पड़ा. तो ये सिर्फ सोचने की बात है. कितना सेफ है आई cannot tell you. Generally half of men, but some women are more aggressive than men, then you can't tell them. But normal limit is that females are more susceptible to alcohol than men. So half of what men drink is recommended. What is permissible, I don't know.
Thank you, sir. Thank you very much.
It's a wonderful session by Dr. Serene. I would call Dr. Mehta to extend a vote of thanks to him, and we compliment, and he deserves a standing ovation for his nice presentation.
Thank you, sir. Indeed, it was a wonderful kick-start of MediFest 2022 from SMS Medical College, and the team MediFest is highly thankful to Professor S.K. Serene, sir, for his so wonderful, so amazing, so informative, and so interesting symposium. We wanted it not to end. So thank you so much, sir. Thank you, Principal, sir, for giving us this opportunity to conduct so informative symposias. And thanks to all the principals and particularly Professor V.B. Singh, sir, who has made the things so interesting. And the whole audience, in spite of having a good lunch, they all were so awake with sir's talk. And I just want to inform that the symposia, the MediFest, again will be starting tomorrow at 10 a.m. in 3 halls. This hall will not have any session. The one hall where we had lunch this afternoon will be Hall A. The hall on left side of mine will be Hall B, and hall on right side will be Hall C. So we will be starting Heart Symposium at 10 o'clock in Hall A, and the School Health Symposium in Hall B, and Arthritis Symposium in Hall C. So we hope all of you to be there, because all these symposias are very interesting, and we want your presence to make these symposias successful. Thank you so much. Have a good day, and we hope that every one of you will enjoy the exhibition from now onward, and we expect that our Health Minister, sir, is reaching exhibition, so we all should be there, particularly showcasing our achievements. Thank you so much all, and have a good day. Thank you so much, sir. And thank you, Preeti ji, for conducting this session so well.
Thank you so much, sir. So सभी लोग please exhibition के लिए proceed करें. See you tomorrow morning at 10 a.m. Thank you so much.
Your meeting has ended.